Let's take a few minutes to get you updated on the latest news about the COVID-19 pandemic. Dr. John Trapp is a pulmonologist and chief medical officer at Bryan Medical Center and a key member of their COVID response team. Dr. Trapp, thank you very much for being with us.
Thank you for having me here today.
Well, currently in Nebraska and nationwide, COVID-19 deaths are increasing. It's a trend Dr. Anthony Fauci, the chief medical advisor to President Biden, told NPR this week that we could see for weeks or even months more. But cases and hospitalizations are dropping in the state. They have been since the massive peak in November and December. Most healthcare workers and long-term care residents are vaccinated in the state. So, Dr. Trapp, the first question is, just give us the general state of the pandemic right now. How do you think it's going? What do you think is next?
Wow. Well, it's been an incredible journey going back to the beginning of the year and how much knowledge we've gained throughout this entire pandemic. We've been anticipating a peak and eventually did see that in really beginning in September, October, but really peaking in November. High hospitalization rates and unfortunately a lot of sorrow during those times. So we are really pleased to see the trend downward. We were very concerned around the holidays that we'd see a peak after that. We really have not seen that big peak. I think people are really working hard to do the things we've been asking them to do with masking and social distancing and just being cautious. So we're hopeful to see this trend continue downward, and as more vaccinations go into place, continue to see decreasing numbers.
So as far as those vaccinations are concerned, we're getting into phase 1B, where you're looking at people 65 years and older, people with high-risk conditions, and then the essential workers will wait after that group. It's going to take quite a while probably to get through that group. Do you think that's a good decision to do it that way?
Well, certainly you want to get the population that's most at risk for hospitalization and not doing well with this virus. So 65 and older, additional conditions certainly makes a lot of sense. Younger individuals less than 50 tend to do fairly well with this virus. Unfortunately, there are some exceptions. So yes, you want to get your most vulnerable population. The biggest limitation right now is just the number of vaccines available to the state.
And are we seeing that trend? Are you hopeful that that's going to get better, that supply situation?
Oh, exceptionally hopeful. We hope that as they ramp up production and continue to do that, and as more people are vaccinated, we will see additional vaccine to the state that we can deliver into arms.
As a pulmonologist or a lung specialist, talk about what you've seen, the impact of COVID-19 on the lungs.
Well, the presentation is generally with symptoms of fever and cough and a sense of shortness of breath. A lot of people may not even be aware initially that they're sick, and we see people present eventually with increasing symptoms and fatigue and find out that they're low on oxygen levels. When we take chest imaging, we see a viral pattern of pneumonia is what we typically see. We support those patients in the hospital, giving them the available treatments that we have, and those are limited. And we really provide best supportive care and hopefully see this gradually improve with their lungs based on their oxygen levels. It's interesting, we'll see people who appear to be stable for a while and all of a sudden dramatically get better, and we send them home a few days later. And on the other hand, we see some people progressively worse, develop a severe lung injury process that results in higher needs for support.
And in just the few seconds we have left, do we have an idea yet about the long-term impact of COVID on the lungs?
I think we're still trying to really understand that. I think there's many questions out there about how this will impact individuals, and so I would say it's still a lot to learn on that.
All right, Dr. John Trapp, thank you very much. And we do want to remind people that if you have questions about the pandemic, about the vaccines, you can go to the Bryan Medical Center website, bryanhealth.org/vaccine, and look at their frequently asked questions section. You can also follow the NET News Team coverage of the COVID-19 pandemic at netnebraska.org/coronavirus.